A very good evening to you, dear listener. Welcome to another edition of your program, NCDC Situation Room. My name is Abdul Fattah Otori. The Nigeria Center for Disease Control, NCDC, on January 21 declared an outbreak of Lassa fever in Nigeria following an increase in the number of cases. Situation report from the Nigeria Center for Disease Control as at week 4 of the outbreak shows that a total of 538 suspected cases were reported from 16 states. Of this, 213 were confirmed positive. Among these positive cases, 42 deaths have been confirmed. States like Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Plateau, Taraba, FCT, Adamawa, Gombe, Kaduna, Kwara, Benue, Rivers, Kogi and Enugu have recorded at least one of the confirmed cases. The reported cases represent a significant increase in the number of cases reported in the same period in 2018. This is of concern, and the multi-sectoral One Health National Rapid Response Team have been on ground in the affected areas to contain and manage the situation. Also, the National Lassa Fever Multi-Partner Multi-Sectoral Emergency Operations Center (EOC) continues to coordinate the response activities at all levels. Today, we'll be telling you what the level of containment is and what you can do to protect yourself and people around you from contracting Lassa fever. Please stay tuned to the program. I'll be back to tell you more after this break.
Okay, Chief Adisa.
What is it? You are calling me with a sense of urgency as if you have something special for me.
Okay, Chief Adisa, this is not time to trivialize the issues. Yeah? Have you heard the latest news on Lassa fever?
Oh, so now you realize there is fire on the mountain, Abi? You see, what an old man sees sitting down, a young man can never, I repeat, can never see it even if he climbs the roof of the tallest house in the village.
Honestly, look, I understand what you are saying from every angle. I got that message right when that old professor was crying during the town hall meeting.
Was it actually a town hall meeting? Well, meeting is meeting, Sha. You see, that old man you refer to, he has seen it all when you talk in terms of Lassa fever in Nigeria. And is very concerned about the number of people that could die if care is not taken by people in authority. That is it.
You see, sometimes I think you talk too much. You think mouth is just, after eating, is meant to just be talking anyhow.
Amy,
what have people on authority got to do with case of Lassa fever in my village?
Usman.
Good evening, sirs. No one.
Kabojari, Doctor.
Sir, you are sure all is well, eh? The way you responded to my greeting suggests all is not well. Is all well between you and Malam Usman? Please, we cannot afford that now. There should not be anything of such now in the city.
Doctor, thank you very much. Look, now I know you are a very intelligent man. This Chief Adisa, he does not want to agree with me that people in authority, they have nothing to do with Lassa fever. Let me tell him, look at him here. Ask him, are they doctors? So for Allah, we have people to manage this disease. Is that not true?
Chinekeme, how do you mean, Malam Usman? The people in authority are expected to take leadership role in the fight against the epidemic of Lassa fever in all our communities.
Sorry, Doctor, Olongbo, I am suspecting this man. I am telling you, this man, he has completely changed. Ever since he started this is interest in politics, he now has this protective tendency for people in political position.
Mbano. The issue of Lassa fever should not be politicized at all. Lassa fever does not know members of any party. In fact, it treats everyone the same way. It does not know Hausa, Igbo, or Yoruba. It does not know white or black. Once it happens, it is in the hands of God, though.
You see, Doctor, I am not here to fight Chief Adisa. You know me, I'm a very peaceful somebody. What I want the two both of you to understand is that Lassa fever is a medical issue. It's not political. Yes. My political interest should not be dragged into this small issue affecting people in the village. But my only cause of worry is why should a whole professor be crying because of Lassa fever?
Mbakwao, you are very wrong.
Very.
You are wrong to describe Lassa fever as a very small issue killing people in the village. Let me tell you, do you know how many people that have died in the last few weeks?
Answer.
Doctor, people die. Are they Oyibo?
You
know Oyibo, they are not very strong.
Look, Doctor, Shongo, look at you. Oyiboko. This These people are our brothers and sisters infected by the disease.
Yes.
And you know what?
No, I don't know. You can tell me.
Okay. Lassa fever is spreading fast, and it will soon catch up with those of you who think you are safe in town.
Stop pointing me.
In fact, it is a more serious matter than you can actually imagine. We are all exposed to this infection. You see those refuse heaps that you people have refused to clear. That's an open invitation to rodents.
Oh, something.
If you think you're protected, what about your driver? That man who washes your car, if he is infected and in any way his sweat drops in a place and you later touch that place, you too will become infected.
Bagam.
What do you do then?
Oh, yeah.
When did we start talking about Ebola? This is Ebola you're talking about.
It is not Ebola, one name, but they are all children of the same father. Yes, they are all hemorrhagic fever diseases. They conduct themselves in the same pattern. It is dangerous, to say the least.
Madam Usman, let me tell you, that professor was not crying for the fun of it. No, it is because of the very ugly situation the man is in. I mean, the levity with which the issue of Lassa fever is being handled by our leader.
No, we have defeated Ebola before, so we will defeat Lassa fever.
Therefore, invest in it.
Abi?
Madam Usman, put your money where your mouth is. It is a collective responsibility.
Shut up.
While the people are expected to observe simple hygiene, government is expected to bring out the money to meet all that is required to check the spread of the disease.
Madam Usman, where are you running to?
Just leave me alone. Oh. I'm going to tell the chairman of my local government that there is a fire in the mountain.
Madam Usman, please also tell him that it is very urgent because...
Thank you very much for staying right here on the program with us, and you too can be a part of the conversation. Let's know your opinion on Lassa fever. Please reach us. We're on Twitter. The handle is @NCDCGov. You can call us or send us a message on 0812 222 2081. That's 0812 222 2081. If you'd like to talk to us via our toll-free line, you can reach us on 0800 9700 0010. I'll take that again, 0800 9700 0010. We expect to hear from you. Thank you very much. Now at this point, let's join Godwin Odemije in the Situation Room to bring us up to speed. Godwin, what's new?
Well, Abdul, I must tell us now that about 16 states are currently battling with the Lassa fever outbreak, and some of the treatment centers are getting overwhelmed with patients. The situation right now requires that kind of attention Nigeria gave when a case of Ebola was reported. Let me now join Chimize Anwe-Yagu, a risk communication officer with the NCDC in Akure, Ondo State. Chimize, thanks for joining us.
Thank you so much for having me.
Now, Chimize, we heard that a week ago, Federal Medical Center Owo was filled with patients of Lassa fever. Tell us, what is the situation this week?
So currently, I'm in Ondo State. The situation of things in FMC Owo is that we have currently on admission 18 patients. Last week, we had a lot of patients who were in the treatment center and we didn't have enough space, but we advocated to the governor of the state who provided a space, and now we have cases that are now in isolation.
So are the patients on admission responding to treatment?
The people in admission are currently responding to treatment. From January till date, we've had 92 confirmed cases, and in FMC Owo, they have admitted up to 77 patients. And out of the 77 patients admitted, we've had 11 deaths. This is a shift in what we used to see in cases of Lassa fever. We have a case fatality rate of 12.2%. Although we at NCDC, we are pushing that we want to have a single figure case fatality rate. We don't even want to have any deaths, but our strategy right now is to push so that we ensure that more people don't die. We are seeing an improvement in treatment.
Okay, you talk about achieving a single-digit fatality rate. How do you intend to achieve that?
So just recently, NCDC will develop a strategy which cuts across different pillars: the risk communication, the surveillance, the lab, etc. So from the activities we've developed in that strategy, it's a 5-year strategy. We hope that those activities are going to push us or drive us towards achieving our proposed mandate.
Now, we hear that about 16 states are involved in the current outbreak. What is happening in other states?
We have other rapid response teams in other states. So the report I'm giving is currently the situation in Ondo State.
Okay, now what are you telling the residents where you are in terms of preventing Lassa fever?
So NCDC will put out Lassa fever advisory. When it comes to Lassa fever, we know that it's rodents, Mastomys satalensis, that carry the virus. So everybody should prevent those rodents from coming into their homes. Keep your homes clean because those rodents like dirty environments and it is where they breed. So you have to keep your homes very clean to avoid rodents from coming into your homes. You have to wash your hands always. When looking after your sick relatives or sick loved ones, you need to be very careful. And for the doctors, we advocate for them to have a high index of suspicion. When someone comes into your health facility, suspect Lassa. So in suspecting Lassa, you need to observe standard precautionary measures. And also to people of Ondo State, the state is working tirelessly to ensure that this outbreak is brought under control. The rapid response team of the NCDC have been with the states for the past 2 weeks now, supporting the states. We've activated an emergency operations center here to coordinate response to the outbreak. And just over the weekend, the governor inaugurated the emergency response committee on Lassa that has the Commissioner of Health as the chairman and has Commissioner of Environment and everybody in the state responding to the outbreak. So all hands is on deck to ensure that this outbreak is brought under control quickly.
Well, Chimeze Anwe-Yagu, I must thank you for speaking with us in the Situation Room today.
Thank you so much.
Wetin be this Lassa fever wey dey here up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus, poo-poo, wee-wee, spit or even blood, and e no dey send age-o.
How fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make face swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
Thank you very much, Godwin Odemije, for filling us in on that. Now I have with me the Incident Manager, Lassa Fever Emergency Operations Center, Ms. Chioma Danwafo. Madam, thank you very much for joining us today on NCDC Situation Room.
Thank you for having me.
So, 213 cases, 16 states, and 42 deaths recorded. What's the situation as far as Lassa fever is concerned? What exactly is going on?
Well, as you have just stated, as at week 4, that is as at 27th of January, we've had a total of 213 confirmed Lassa fever cases from 16 states with 42 deaths, giving us a case fatality rate of 19.7.
Now, Ms. Chioma, that's very, very scary compared to what we had in 2018 at this same period. What's responsible for this high number?
Well, in 2018, last year, we recorded a large outbreak, and going by the prediction, we expected more number of cases this year because, one, our surveillance system has improved. That means we are detecting more cases, we are testing more cases, and we also have increased the number of Lassa fever testing labs in our lab testing network from 2 to 4. So we have more labs testing, people are more aware, they're presenting at the facility. Healthcare workers also have a higher index of suspicion. So when cases present, they think Lassa, samples are collected, tested. So that is why we are seeing this high number of cases.
So what exactly is the response level like? I'm aware there's this One Health approach to this. Tell us about it.
Yeah, so as at the second week, given the number of cases we recorded, we had to immediately do a risk assessment, and that led to the activation of a national Lassa fever emergency operations center at the level 2. Initially, we had a national Lassa fever technical working group that coordinates this response. It's multi-sectoral, it's also multi-partnership with other organizations such as WHO, US CDC, AFINET, MSF, UMB, and other partners. So when I say One Health approach, it means that the Ministry of Environment and the Ministry of Agric is also on board. They've been part of this Lassa fever technical working group because we understand that for prevention of Lassa fever, it does not lie solely on the Ministry of Health, on NCDC. The Ministry of Agric and the Ministry of Environment have an important role to play in terms of environmental sanitation, rodent control measures, how food is stored so as to prevent contamination with the rodent feces and urine that could lead to this disease.
So as NCDC, what's being done right now to ensure the cases are contained?
We deployed National Rapid Response Team to the field, to the 4 most affected states. These states are Edo, Ondo, Ebonyi, and Plateau State. And we also plan to deploy more teams to the state as the need arises. That team is also a One Health approach team. We have Ministry of Environment, we also have Ministry of Agric role, so that at the state level, these communities and LGAs where these cases are presenting from, the cases can easily be detected and can also institute control measures that will lead to the reduction of cases and attendant mortality. We've also distributed response materials such as the medicine for management of Lassa fever, personal protective equipment, information and education materials to all the states and FCT. We've intensified our risk communication activities through press releases, media engagement, and also trying to reach traditional rulers and religious and community leaders at the community level. So these are community influencers that could help pass this message down to the people.
Okay, now I'd like to know if there are specific factors driving this 2019 outbreaks. Because before now, we weren't hearing about Plateau State as part of the hot zones. But now we're talking about it. What exactly are the predisposing factors?
Well, Plateau has been one of the high burden states that have recorded Lassa fever cases going by our historical data. So it's expected that they will have cases this year, including other states that are high burden states. But then with the high number of cases that we get, as I've earlier said, surveillance has improved. We are detecting more cases, we are testing, that is why we are seeing more cases. And then the common denominator for this outbreak is that most of the communities where these cases are coming from have poor environmental sanitation condition. And we know what the vector for the disease is. So when you have a breeding ground for them, it helps to bring them closer to the human habitation, and this leads to transmission of the disease. So that's why we need the Ministry of Environment and Agric to play the role of prevention in collaboration with what we do in risk communication. Because currently there is no vaccine for Lassa fever. There are different scientists that are working on vaccine candidates, but as it stands now, we do not have a vaccine. So what we keep preaching is prevention, prevention, prevention.
So this latest outbreak, is it more of rodent to human or man-to-man transmission?
So for the 2019 outbreak, most of the cases we have recorded have been rodent to human transmission. We've had some clusters that we cannot categorically say that they are human to human transmission until we do further genomic sequencing. For the 2018 outbreak, we were able to do that, and we ascertained that most of the transmission are still rodent to human transmission.
In other words, preventing rodents from accessing homes still remains the best form of prevention.
Yes. So preventing rodents from having access to what the food we eat and any environment, because people can pick the virus where the rodents have defecated their feces, their urine. It can contaminate anything that we eat when we leave them exposed. So, and it could lead to infection. So what we preach is that all members of the public should focus on prevention by practicing good personal hygiene and proper environmental sanitation. Wash your hand always with soap and running water. Use hand sanitizers when available. Wash contaminated surfaces of your house with soap. And then store your grains in rodent-proof containers where they will not have access, where rats will not have access to the foodstuff. Also, dispose your refuge properly. Communities should also set up dump sites. We are working with Ministry of Environment to ensure that the refuse that are in the different communities are cleared. And then we also advocate the states and the LGAs to engage the community environmental workers, the health environmental workers at the different LGAs to do their work, to ensure that our environments are clean. And protect your house from rats. If you have any hole in the house, try and block it so that the rodents will not have access to the house through the holes. Then we also advise the public against bush burning, because we notice that in dry season and there's a lot of bush burning, so we chase these rats from their natural habitat closer to where we are. So we discourage any form of bush burning. And like I emphasized, hand hygiene is very key. It's not just for Lassa fever, any other infection. If we can get hand hygiene right, we end up taking care of a lot of other infection and environmental sanitation too.
Okay, so now what are you doing with the healthcare workers in terms of prevention? For
healthcare workers, we know that Lassa fever also is transmitted via human-to-human transmission, and healthcare workers are at risk. So what we preach is that if a patient presents to your facility, first adhere strictly to standard precaution, irrespective of what the provisional diagnosis is. Even if it's malaria, whatever you think it is, wear your personal protective equipment, your hand glove, your lab coats, protect yourself before managing any patient, so that you keep safe while you keep serving. And also have a high index of suspicion. When a patient presents and that malaria is not responding to treatment, please think Lassa. Collect the sample, notify the appropriate authorities. Samples will be collected. Sample testing is free. We have 4 laboratory Lassa fever testing labs in our network. These samples will be tested there, and if it's Lassa fever positive, the case will be referred to a treatment center for proper management.
Okay, Chama, let's talk about case management. How well are you doing managing these cases? We hear that the centers are filled now.
So, given the high number of cases that we have, some of our treatment centers are actually overwhelmed. For now, the ERA treatment center, which is like the center of excellence. I've had a lot of many years experience in managing Lassa, and also the FMCOW that just came on board, but then is a treatment center that have done so well. They have been supported by the Alima organization. Yes, for Owo, they're overwhelmed in terms of the bed capacity and also the staff strength. So what we have done is to support them with a such staff. We have supported them currently with doctors, nurses that could help, to manage the cases that are coming on. Then for the bed capacity, there have been advocacy to the state lead. They've been able to designate the accident and emergency, the trauma center that was just built for Lassa fever at the interim, while these cases are on the rise, and we expect more cases in the next 6-7 weeks. So that is the measures that have been put in place. We also support them with more commodities, because we understand that what they have on ground is not enough, so we'll support them with more response commodities for managing of these cases. Likewise, IRUA, we are doing the same thing for the IRUA treatment center, but like I said, they have more experience and in managing of cases, but we'll continue to support them. We have a team on ground. If there's any problem, they escalate immediately to us, and we do all we can to ensure that we do not lose any life. Our goal is to have a less than 10% case fatality rate. We know that these cases will keep coming. We do not have a vaccine yet, but then we do not want patients to die. So we do all we can to support case management. There is a lot that goes into case management. We also provide a drug free of charge to all the treatment centers. No patient pays for the drug. We also provide the personal protective equipment for the healthcare workers and some other commodities. But then there's still more to the management of Lassa. So we continue to advocate for free treatment of Lassa fever cases.
Let's talk about your collaborations with the State Ministry of Health, especially in the high burden states. How well is this going?
Well, Lassa fever response is a state response. So what we do as NCDC is to support what different states are doing in the response. So we are collaborating very well with them, and we also advocate for more political will to provide the necessary funding needed so that the burden will not just be on NCDC, provide funds for surveillance and then also for the response commodities that are needed to manage the cases.
Let's talk about risk communication approach and how do we prevent this from happening?
So our message is still the same. Keep your environment clean. Dispose all the refuse properly. If there are holes in the house that could lead to rats gaining access, block all holes. Ensure you practice hand hygiene. Store your grains in rodent-proof containers. Do not spread food substances by the roadside so that rats will have access to it, defecate on them, urinate on them, then we consume it and then become infected. So if anybody is sick, go to the nearest health facility. Do not self-medicate. Avoid any form of self-medication. If Lassa is suspected, sample will be collected and tested. It is free of charge.
So at what point would someone who is experiencing signs or symptoms need to go to the hospital? Is it after having a headache or high fever?
Lassa presents with a wide spectrum of symptoms in different people. Well, for some, it could be fever. It could be sore throat. We have had cases that did not present with fever, cases that just had sore throat. Fever, sore throat, vomiting, that fever that has not responded to malaria treatment, then you think Lassa, go to the nearest health facility. A physician will examine you. It's the judgment of the physician that determines what next to do, if you're a suspect case or not, and the samples will be collected and tested. If it comes out positive, then. So that is why we advocate for a high index of suspicion among our physicians. And we've done a lot of sensitization. That is why we are seeing more cases. Physicians are suspecting and more samples are being tested, and we're detecting more cases.
Okay, so what exactly are you doing to ensure that this outbreak is contained? How do we protect those states with no case at all?
So before this outbreak started, we had sent an alert letter to all the states on what to do, and also sent advisory to them that we are in the high season and that all healthcare workers should maintain a high index of suspicion. And we also emphasize on environmental sanitation and all that one needs to do to prevent Lassa fever and to preposition response commodities, because these cases can present from anywhere. The cases can also be imported from one state to another. We know it's a global world. A case can be in Edo today. The next day he travels to Kaduna or Katsina, in a state that have never recorded a case. So all we say is that every state should be ready, and we have response team on ground. What we do is to try to assess the capacity of the state to respond. From our assessment, then we send our RL teams down to the state to provide on-site support. But we continue to coordinate all activities from the national. We are in touch with the state. We call them. We try to raise their suspicion and to also improve their surveillance, to go out and also search for cases, do active case searching at the community level. In case if these cases are hiding at the communities, they will be easily detected and referred to the treatment center for proper case management.
I must say a very big thank you to you, Chioma Danwafo, Incident Manager, Lassa Fever Emergency Operations Center, for speaking with us on the program today. Thank you very much.
Thank you for having me. It's my pleasure to be here.
Well, that's the size of the program, NCDC Situation Room today. We thank you for being a part of the program. We also hope you'll join us again next week. Now, if you want more explanation on what you've heard today, or you just want to know more about the Nigeria Center for Disease Control, NCDC, please reach us. We're on Twitter. The handle is at @NCDCGov. You can call us or send a message on 0812 222 2081. That's 0812 222 2081. If you'd like to talk to us, we have a toll-free line. You can call us on 0800 9700 0010. That's 0800 9700 0010. We'll expect to hear from you. Thank you very much. This program is a production of Gado Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. You can visit their website to know more about the center at www.ncdc.gov.ng. The executive producer is Godwin Odemije. He also wrote the drama story. Mobolaji Ajani is the producer of the program, and I am Abdul Fattah Otori. Have a very good evening. Bye for now.